I'm not a nurse.
And I'm not a pharmacist.
I'm not a physiotherapist.
Nor am I a podiatrist.
Guess our professions.
Hi, I'm Ashley.
Hi, I'm Shriya.
And we are both health tech professionals.
So Ashley, tell us a bit about yourself and why you decided to pursue a career in health tech.
Sure, Shriya. I'm currently a software engineer at Integrated Health Information Systems, or IHiS for short. Since young, I enjoyed playing video games as well as custom building my own PCs. So it's an easy decision for me to choose a career in IT, seeing as to how closely attuned to electronic devices I am. As for why healthcare and IT, my job has enabled me to apply what I've learned in IT in healthcare. I also get a great sense of satisfaction for being able to interact with medical professionals as well as patients, and also being able to create useful applications for the overall Singapore healthcare system. So what about yourself?
So I'm a systems analyst at IHiS, and my interest in business analytics started when I was in junior college, and I learned more about how data was helping to transform organizations. This is why I decided to pursue it as my major in university. So I always wanted my career to be a mix of both passion and purpose. Analytics was something I was passionate about, but I realized that working in a large, profit-driven company did not give me the sense of purpose I was seeking for. Luckily, I attended a talk about the healthcare system, and I learned about how you don't have to be a frontliner to contribute to healthcare. Being an administrator is also very meaningful, and that's how I found myself joining the IHiS team.
What are some of the roles and responsibilities of a systems analyst?
So as a systems analyst, my main role is to be involved in the development process of an IT system, all the way from gathering requirements, to testing, to developing documentation. So currently, I'm working with the next generation electronic medical record project, which aims to provide a new centralized platform capable of recording patient journey all the way from admission to discharge. So my main responsibility is to ensure that data from the old systems are accurately available in the new systems for the various user groups to use for analytical purposes. So what about you?
As a software engineer, my main role will be to develop features. However, being a software engineer, it does not just end at development of features. There's a lot of code testing and code review that we have to go through to ensure smooth deployment into the public healthcare institutions. As for my project, currently I'm working on One Rehab, which is part of MOH National One Rehab Framework. Today, there's no harmonized way of planning rehabilitation care as well as to track clinical outcomes for our patients. So we aim to facilitate these two processes by creating a common platform where caregivers of different institutions are able to track their own outcomes and goals. This will allow our patients to both have a smoother healthcare journey as well as a more efficient one.
So what does it take to be a good software engineer, and what are the skills required?
A good software engineer should have a good attitude as well as an open mind. When you first come into the workforce, there will be a lot of things that you do not know. And it is common, as it is impossible for school to teach you everything that you need to know. Personally, over here at IHiS, I was able to pick up a whole new programming language in under 2 months with the help and guidance of my senior software developers. It is because I had an open mind and a good attitude that allowed me to garner such experiences, and I feel that's what makes a good engineer. So what about yourself?
So a good systems analyst should be able to have good communication skills and be willing to learn. So we are the bridge between the users and the developers, so it's important to effectively communicate with both parties. Also, healthcare is a vast domain, which can be very complex and challenging, especially with multiple institutions involved, which is why it is very important to be eager to learn and understand. As a healthcare administration scholar, what are some of the benefits that you received, and how has that helped you?
After receiving the scholarship, needless to say, there was a big weight lifted off my shoulders as my tuition fee and my daily expenses were covered, such as food, transportation, as well as academic materials that I require throughout my course of study. We can also tap on the Scholars Development Fund to go on relevant courses to supplement our skill sets, and even go on overseas exchanges and conferences.
Apart from the monetary benefits, MOHH offers its scholars many networking and development opportunities, such as the Healthcare Induction Program, which is a series of seminars and a camp to help scholars learn more about themselves, their fellow scholars, and the healthcare system as a whole. You can also join the Singapore Healthcare Society, which offers many fun and development opportunities such as language and dialect courses.
So, do you have any advice for our future scholars?
I would encourage all aspiring scholars to do their research before choosing to join health tech. Do attend the virtual talks held by the MOHH scholarship team. and ask questions about the healthcare system and your potential role in it. Do talk to the other scholars and learn from their experiences so that it can help you make your decision.
Health tech is a popular and established field, and the demand for health tech professionals will grow even greater in the next 5 to 10 years. So join us as a healthcare administration scholar and be part of the future.